rotating foods is going to be super important to prevent sensitivities to those foods from developing. Hey there, I'm Dr. Ruth Roberts, the original holistic pet health coach. I hope everybody is having a fantastic day. And as folks are jumping in, I'm going to tell you a little bit about what's going on in our world. I am getting super excited. In April, I'm going to be joining the BK Pets folks, Bryce and Kenzie, in 2 locations in Scottsdale. Actually, I think 3 or 4. For the last 2 weekends in Arizona, we'll be there and hanging out. Coaches are going to be there ready to help you help your pets. If you live in the Scottsdale, Arizona area, definitely make it a point to come. This book tour has been amazing. The BK Pets folks are educating from the stage, along with several other folks that I love in the industry, including Angela Ardolino from CBD Dog Health and Micah Dog, and love her products. If you don't know them, you definitely need to go check that out. And the 13th of April, I will be in Charlottesville, Virginia, and at the Pillars of Health meeting there. That's going to be super fun. That just really looking forward to all this travel, getting to meet and greet you. And we'll be posting details both in Circle, obviously on our social media as well. And we've got a page being built so you'll know where I am and where I'll be speaking, where we will be able to meet and greet with you. Our coaches are going to be there so you can talk with them, help and get some help for your baby. So Lisa, good to see you. Michael said he's working with you, so that's awesome. I know you've got a lot going on, but I think he's going to help you dive down and sort things out. So that's great. Yeah. On baby's thesis, he said there's a lot. So we just keep rolling through it and keep getting questions answered as best we can. So if you are not familiar with it, this is our free community in Circle, and we're using this platform along with Facebook because we can create a little bit more intimate setting, so to speak, and answer your questions in details. Coming soon, we will have the coaches starting to do some complimentary education within this group. If you have not checked out Circle, definitely go do it because it's a great group. Lots of great information going on in there. Lots of free events. We've got many of our partners coming in to educate you, teach you about what they do. And the other thing is there are 3 free courses. So actually 2 courses, one on kidney health, one on gut health. And then this one is about holistic pet hair program. So essentially my protocols for supporting pets. Looking forward to speaking with Zach Au next week on Viva, the owner of Viva, one of the founders. And he's just a really great guy. Totally got the idea of what's up with the link between using whole foods and helping people return their pets from a place of illness towards a place of wellness. So Leah, good to see you. Lily, good to see you. So actually I'll be in your neck of the woods on the 13th of April. So keep an eye out for that. And Michael, good to see you too. So hope that everybody is having a fantastic day. As always, feel free to drop questions into the comments here. I'm going to start on some questions that Erica pulled out of our Circle group for us that are burning in folks' minds. And so this first one is from Maritza, who's actually one of our coaches, and she's got a 12-year-old ratty mix. Okay, so rat terrier and who knows what else. And she's worrying about anesthesia for post-dental. So I think all of those things you can use. To be fair, homeopathy is not something I have a great deal of expertise on, other than using some limited protocols, especially with regard to vaccination detoxification. I used to use Heal products when they were available in the US, but unfortunately the FDA asked them to pull their products from the market almost 10 years ago. So what I would suggest is this. If we know that anesthesia leaves some things in the body we don't want to have there, then I think thuja may or may not be a great option. I would definitely use that in the homeopathic form just because the taste is a little tough. The vaccines, I think you can make it either way. But if you use thuja, I would use a 12C and then liposomal glutathione and some sort of binder. So one of the things we have available in the shop is something called GI Adsorb by Standard Process. It's a clinoptilite and collisonia product, and that's been super helpful. There is humic and fulvic acid binders like Polypet has, and got some exciting news coming on that in the next few months. And then just making sure that she is eating and drinking really well. If you are working with a veterinarian that has experience in acupuncture, what we used to do is inject B12 into multiple acupuncture points, and that really improved the ability of that pet to recover from anesthesia quickly. So I would look at that. If that's not available, you could look at doing acupressure on those points as well. Let's see. So got another one from Pam. And Pam, good to hear from you. So lipomas are an interesting thing. Spirit's a good guy, and he's been around the block for a few years. So he's already on turmeric, CBD, quercetin, and a probiotic, which is great. You're doing wonderful support. Now, it's interesting. In Chinese medicine, these are considered to be phlegm. And so one of the things you can do is work on resolving phlegm. And you would do that by one of the simplest things is to use seaweed. So you can use the Escaleptum nodosum, I think I'm saying that correctly, which has been shown to help reduce tartar on the teeth. I use that. The seaweed softens hard nodules. You can use little sheets of nori, seaweed, things like that. So that's a great way to go. And then there are some formulas in Chinese medicine that are designed to help resolve phlegm. The one thing we do know is that the CBD salves that Angela makes sadly don't have much of an impact because it's so hard to actually get to the fat cells themselves. So that's not so helpful, sadly. So let me just do this. And Cindy, pop your question up here. Oh, poor baby. So you've got a golden who's been having grand mal seizures since June. Yeah, Cindy, any of the coaches can help you with this, plus get you on a supplement regimen that is going to make it easier for you to get these seizures under control. That's one of the things that has been super successful for the majority of our coaches when they're working with clients is to work out diet. They can offer you a keto version of the original Crock-Pot diet. And as long as your dog has not had any issues with pancreatitis, this can be a super game changer. And then they can suggest appropriate doses of CBD and other supplements to help you control the seizures as well. And they're accustomed to working with your veterinarian if your dog is already on some sort of an anti-seizure medication. So I think, let's see if we've got, let me grab that link for you so you can find a coach to work with. But that's definitely part of their training. So it's been a real benefit for so many people. So go check that out. It's definitely going to be a process, right? Because we are working on fixing things from the inside out. And indeed, it's a process that didn't happen overnight. And Lily, you can use quercetin. So depending on the size of your dog, I would say somewhere in the neighborhood. How big is your dog? I think I'm remembering it's a relatively smaller pet. To really get the effect therapeutically, you're going to want to be using somewhere around at least 50 milligrams 2 times a day for a dog under 25 pounds, and you can use it up to 4 times a day. The one 35 pounds, cool. So I would start with that dose. The one downside with quercetin is it can cause some nausea, so definitely give it with food if you can. But for instance, when I personally, this is something I'm taking every day because it just prevents so many allergic reactions for me. So currently I'm taking 800 milligrams twice a day. When I was still living in Charleston and things were bad, I was taking 1,600 milligrams 4 times a day. So you just have to see what works, start with the twice a day dosing, and then gradually work your way up from there. And then obviously you want to really work with somebody to help get things under control, because this is going to relieve symptoms, but not necessarily address the root problem. So right on. So you've got a couple of them. So it sounds like you may have some stuff going on in your house that's affecting your pets. So let's jump back over here and keep rolling through the questions I've got. Tough one. A kitty with pancreatitis. It's interesting. So 7-year young kitty boy. So I think cats are difficult because they can be difficult to switch into food. If you're going for recipe recommendations for crock pet, that means hopefully that your baby is already eating them. Let me pop this over, sorry. And that's great. And so what I would suggest, if your cat is just now eating kibble, start by switching to canned food, and you'll want to use a lower fat canned food. And if your cat's already eating canned food, pull the kibble out and go switch to crock pet. And what I would say is follow the starter recipe in the crock pet book and use about half of the fat that's in that recipe. In terms of other things to prevent the pancreatitis from coming back and to help the gut heal, I would definitely look at omega-3 fatty acids. And again, because they're oil-based, use a concentrated product, so you'll have to use just a minimal amount of fat. And so using a megapause, you would need something like a 1/4 teaspoon per day. And then also add in a probiotic to help the gut start to get supported. I would also definitely suggest that you, again, work with a coach, because the underlying mechanism is inflammation. And so anything we can do to reduce inflammation, we're going to help support pets better. And let's see. Got this one. So Stacy, welcome. I love your business name, Canine Enrichment. That's so important. So sadly, another case of pancreatitis that's created a few issues. Sounds like she's super fat sensitive right now, and that's pretty miserable. Not sure what you're doing in terms of feeding. And what I would suggest is, if you're not feeding some sort of a whole food diet, I definitely would. So the steps I just mentioned for supporting a cat with pancreatitis are going to be the basic first steps for dogs as well. In conventional veterinary medicine, they've been saying, oh, it's all the fat. It turns out that it's actually the high carbs creating inflammation in many cases for these guys. So it's tough. So start with lowering the fat, pulling out things that might create sensitivities. This is also where I would suggest doing a Glacier Peaks test to determine if there is any food sensitivity. So the Pet Wellness Life Stress Scan, which I need to rechange the name in my mind. They've renamed it, and the report is much easier to look at. So go check that out. That's a great way to get started in terms of figuring out if there are food sensitivities as well. And yeah, Lily, mushrooms can absolutely be a game changer. So that's a starter. I would definitely recommend Vitality mushrooms if you're not familiar with those. Angela Arlino's Mycodog does an amazing job at producing high quality mushroom products that are only the fruiting body of the mushrooms where the active molecules are. So go check that out. Let's see. Yep, I did reply, Cindy, and so if you go back and listen to the replay, but basically this is a common thing. What I would suggest is working with a coach, because you've got It's not just going to be diet. You need somebody to help you look at the entire picture to get this under control. They can make suggestions for you in terms of how to support seizures with food, in terms of keto diet, but that's where you're really going to see a big benefit if you jump in there. So again, here's the page to go find a coach to work with, but this is part of all of their training. So go check it out. And yes, you can feed too much kelp and seaweed. It's interesting. You can see thyroid function get turned off. We've used it to support pets, but if you really go overboard with kelp and seaweed, too much iodine will diminish thyroid function. And right on, go check that out. Check that coaching page out, because these folks are there to help you. That's what they've been trained to do. So let me pop this back up and come back over here and find the next question. And this person is experiencing some problems with their dog in terms of peeing in the house randomly. And so they took their pup in. So Dave took his pup in and found all of this information. And I think, Dave, based on this, I don't see the kidney values of BUN and creatinine. Your step one is to get your dog off of dry food. Don't go to the kidney diet yet. Simply by putting more moisture back in the diet, even if there is some mildly elevated BUN and creatinine, what you're going to see is that adding moisture improves the ability of the kidney to function. And many people have found that after 2 or 3 weeks of switching to a moisture-rich diet like the crock pet, the numbers go back to normal. And the urinary accidents go away as well. Now, the interesting thing is with the estrogen, I think that is actually amazing. And the reason is this. Part of the reason we are seeing so many episodes of chronic disease, ranging from kidney disease, liver disease, IBS, autoimmune disease, cancer, all of this stuff, is because our pets have been spayed and neutered. Now, don't misunderstand me. I'm not saying don't spay and neuter. What I am saying is that we know that when pets are spayed and neutered early in life, their levels of luteinizing hormone are 20 to 30 times normal. And what happens as well is that the tissues that should not have receptors for luteinizing hormone develop receptors. And this is body-wide: brain, adrenal glands, in the gut, in the bones, in the joints, in the bone marrow. So this is really where I believe is a super big problem. So it's one of these things that we now need to make sure that the diet is impeccable and that we are able to really support the body's ability to both assimilate nutrients and detoxify with a healthy microbiome, and improve the liver function and the liver's ability to remove excess hormone and other toxins. CBD is always going to be a go-to in this situation, actually for almost every pet, because we know that it helps to return the body to homeostasis. And almost every tissue in the body has at least one type of CBD receptor, and many have both types of CBD receptors. Home cooked food, support the gut, support the liver, add in a CBD product like CBD Heal. Or if you've got some arthritis, CBD Ease. Or if you've got a dog with anxiety, CBD Dog Health Calm or Hemp Dog Health Calm. And excitingly, we are adding the cat products to our shop, as well as which for the big dogs is definitely the way to go, especially for dogs that have advanced diseases like autoimmune disease and cancer. It's easier to get the dose that they require into them on a daily basis. And that dose may be 50 milligrams per day, regardless of the body size. And beets, I think, are great. So, it's a great source of fiber. They have a lot of positive benefits in terms of increasing nitrous oxide. They can, when they're cooked, they can be a little sugary. So I don't think you want to add in 2 cups of beets, but maybe you're going to throw in 1 beet per recipe or every other recipe. So again, rotating foods is going to be super important to prevent sensitivities to those foods from developing. It's a great food. And then Lily, yes, that's the whole deal with holistic total body support. I couldn't find, I love the idea of glandulars. Standard Process did not have and still does not have a product that actually will balance a diet. So that's why I created TBS. We also have something called daily wellness support for pets that are sensitive to beef and pork, and because the glandulars come from cows and pigs. The glands are sourced from Argentina and Brazil, so a lot of grass-fed beef there, much higher quality than a lot of the conventionally fed animals here in the US. And then Michael, so on pre-made raw, perfect weight, back end weakness, arthritis, slightly elevated AL, lost her hearing, and she's otherwise in good shape. So first of all, PEA, I know I've not seen super good results with it. What I would suggest you do is look at her diet. What I find is that a lot of older dogs, as they start to age, they can no longer efficiently digest raw food. So what I would suggest doing is because back weakness, arthritis, and slightly elevated ALP tells me that there is chronic inflammation present in the body. So I would look at doing Glacier Peaks tests, look at food sensitivities, and honestly converting to a cooked diet to see if we can improve her digestion by pre-digesting the food by cooking. And then I think you're on the right track with the mushrooms. I don't know Maine Harmonic Arts. I would encourage you to make sure that this is fruiting body only and not the mycelium, because mycelium products often contain the substrate the mushrooms were grown on. And if that's not a log, you could be feeding sawdust to your dog in the mushroom product, which carries arsenic and a whole host of other yucky stuff. I think the Lumbrex is good. If that's been providing relief, that's wonderful. High doses of omega-3 fatty acids. And Job, I don't know if you're familiar with this product, but that is a really interesting joint supplement. Dr. Christina Colamanazzo has been able to provide some really interesting research in terms of what does work for joint support. And I like the format because it's been really easy for dogs to digest. It does include a lot of turmeric, so that may be a bit off-putting for some dogs, and some dogs not so much. And then, Michael, honestly, go work with a coach, because you've got an older lady and you really want to optimize everything you can for her in terms of improving her health, improving her quality of life. And then, wow, okay, intervertebral disc disease. He's been on carprofen since 19. Famotidine and milk thistle. I think there's a couple things you can do. One is, when you're at the vet, asking about the blood and the urine. Is it a urinary tract infection? Is it from crystals in the urine? And get some feedback there. Famotidine is covering up the symptoms and preventing gastric ulceration from the carprofen. And it's great that you're adding in milk thistle, because that definitely helps to support the liver here, which is one of the target organs for toxicity for carprofen, as is the kidney, sadly. What I would do is CBD. This is where, for our dog Hayo, she's been having some neck arthritis. And so we had to take her from her normal dose of 18 milligrams up to 50 milligrams per day. Made a huge difference. So I needed to use a little bit of prednisone for her because her tummy will not tolerate a non-steroidal drug right now. And so the cool thing is that with 3 doses of prednisone, she's back to feeling really good, moving well, walking well. So we're starting to taper off the pred already. So this is where you can use prescription drugs to help get you over the hump until some of these other things kick in. So again, this is where work with a coach. They can get you all the options and help you work through what works, what doesn't work, and when to pivot. But it's going to be critical to work at the underlying mechanism, which is inflammation in this situation again. So we want to work on gut function, because if we can get the gut to heal, then we reduce the amount of inflammation in the body dramatically. Hey, y'all, I am so excited you're asking questions. This is a ball for me. Check that out. And then right on. I think that gently cooked or even fully cooked. So I'm going to get on my soapbox for a minute, and y'all just bear with me. So the information out there is that raw is the ancestral diet of the dog, and it is true, but for wolves, the progenitor species to the dog. Raw is also our ancestral diet, but for 2 species prior to us. If we tried to eat everything raw now, the majority of us would have a disaster, right? We'd have IBS and all sorts of stuff. What I want you to understand is that Canis familiaris split off from Canis lupus, the wolf, somewhere between, estimates are 15 to 40,000 years ago. And I think we're getting closer to that 40,000 year mark with all the discoveries that's going on. Dogs grew up, developed by eating our garbage first, which included our poop. So that's why their microbiome is similar to ours, and we can use human probiotic solutions and other solutions to help improve the gut. They grew up with us eating, yes, meat, but also what we foraged for. And y'all, we were baking bread 30,000 years ago. Fire has been present for 50,000 years. We have been cooking this long. That's part of what helped us develop our big brains, which we don't use so well sometimes. But my point is this, is that dogs really, they have been eating cooked food and our leftovers. So first our garbage, then our leftovers, and then finally what we fed them for minimum of 15,000 years and probably closer to 40,000 years. I think that in TCVM, traditional Chinese veterinary medicine, this is why I say fully cooked, because the goal is to present the stomach, the cooker of the 100-degree soup, with something at the correct temperature and already somewhat pre-digested. This makes the digestive process, that the spleen with a capital S, Chinese medicine spleen, much easier work for it to do. So gently cook, I think, is definitely a better bet than raw. And I would say that even fully cooked is better. So this is the sad truth, is that when I still had my practice in South Carolina, I cannot tell you how many of these people were coming in with dogs with IBS and they were feeding raw. We switched them to a cooked diet. The IBS went away. So I think that what's out there is a party line, but I don't think it's accurate. And in fact, there was a study looking at the ancestral microbiome and comparing it to pet dogs in South Africa that were eating a kibble-based diet for the most part, so like us in the US, dogs in India that ate a combo of what they were foraging for and what the families fed them, which again is going to be largely rice and beans, and then street dogs in Laos that were foraging for food and leftovers and garbage. And if you think about what most Laotian people eat, it is a rice and vegetable diet. There's not very much animal protein. So who do you think had the most similar microbiome to the ancestral dogs? So we're talking 30,000-year-old dog poop that we're evaluating the microbiome. So before any conventional agriculture, et cetera, et cetera. So it turns out that the Laotian dogs were the ones that had the most similar microbiome to the ancestral microbiome. So right on, it's a total game changer when you start to think of it that way. And Rachel, yeah, I cannot speak highly enough about this test. It is easy, it's simple to do, it's as effective or more effective, in my opinion, than, say, NutriScan or the blood-based test that we can do in the veterinary office. That's why I started promoting this test, and that's why I joined their board of advisors, because it works, it gets us great information to work with, and it is a total game changer for many dogs. We know exactly what to avoid. Lori, great to hear from you. A Whippet puppy, 14 weeks old. I think that you're definitely on the right track. And then with this puppy, because you're just making sure the microbiome adjusts nicely, I think you could give probiotic maybe once a week, once every 10 days, something like that. I would consider, you definitely need to consider some source of omega-3 fatty acids that is either algae-based or fish-based. Sadly, flaxseed oil, they don't absorb the omega-3s from that very readily. And then the other thing you may consider is, and I'm not sure if your pup is neutered or spayed at this point, or spayed rather, is CBD at low doses, say something like 10 milligrams a day. And the idea is that you're going to help the body stay in homeostasis. If your dog has been spayed already, or you're anticipating that she will be in the not too distant future, this is when I would add in something like Simplex F by Standard Process, because we want to support the body's ability to make those sex hormones at low levels. So right on. As far as cooking, so this is it. We want to use a cooking method that's going to add very little environmental heat, right? And so 350 is hotter. So if you look at the temperature that's in most of the crock pots, it's somewhere around 250 to 275. So we want low and slow. And actually, there are studies that show that this is the way to cook to add the least amount of Maillard reaction proteins, otherwise known as advanced glycosylation end products, otherwise known as AGE or age. And these are the molecules in processed food and in the lining of the bag and in the can of food that creates that aging process that damages the tissues, all of that good stuff. So right on. That's definitely what you want to do, is low and slow. And that's part of why that cooking method works well, because we're not adding so much heat. Cool. FIP is a tough one. Sorry, I hit the wrong button. Things keep moving. It's great. So freeze-dried meals, bar, or foods. Great if you're traveling. Is it a great idea to use on a regular basis? Probably not, because again, they're going to have more, the more highly processed food is, the more AGEs will be present. So I think you need to work on, if you're doing a really vigorous activity like agility, or you're doing search and rescue training, something like that, is use those bars, because you want to keep the nutrients up, the calories up, to keep your pup working well. And cod liver is okay. It is higher in vitamin D, higher in vitamin A, so you don't want to use it on a regular basis, but rotate it in, especially in the winter, to help add those in and protect from colds and that kind of stuff. And I saw something about FIP, which I've lost in these questions, but it's a bear to deal with. And there's kind of two forms. The virus itself that causes FIP is long gone, but what's happening is the immune system is continuing to react to it. So I know there are FIP warriors out there that have access to a product that can be very helpful, although not 100%. So again, the concepts are the same. Reduce inflammation, calm down the immune system, support the gut so that we can provide good quality immune function. And again, work with a coach. These are tough diseases to handle. And conventional vets, I've been in those shoes. We don't have a lot of good options to offer you other than prednisone, the goal of which is to suppress immune function. I'm glad you're enjoying this. I really have a ball doing this. So it's I usually have a coach come on me, but I still love doing these Q&As every week. Canine dilative cardiomyopathy. The deal with that is we said to the dog food industry, we want grain-free diets. So they gave it to us. But what they gave us was a diet that was 70% or more carbohydrate based in legumes. Even when they are properly cooked, will still give some anti-nutrients like lectins that can create an issue with absorbing adequate amounts of taurine. I think those are all good things that you're doing. I'd encourage you to consider cooked diet as well. All beans are not bad. It is a great source of protein, fiber, and phytonutrients for the gut. So I think it's a good thing to use, but it shouldn't be 70% of the diet. So when you look at how do we divide up macronutrients of protein, fat, carbohydrate, roughly my way of looking at it is that in Paleolithic times, it truly was roughly a 1/3 split, and probably a little bit lower on fat because fat's difficult. We didn't have all of these oils that were easy to produce. So we're eating animal fat primarily, and then fats that are in the food. So I think 30% high quality protein, 30% high quality fats, and then 30% or 1/3 of high quality carbohydrates. And what are those? Vegetables, certainly. It could be potatoes, it could be sweet potatoes, it could be legumes, it could be whole grains if your pet can tolerate them. And again, this is if you're not sure what to do, I would definitely do a Glacier Peaks test. See if your pet can tolerate them or not. Many of these guys will test positive for grains. And what we find is that if we take them out of the diet for a while, we can reintroduce them, but you do need to be careful to use non-GMO and organically produced stuff. Lily, it sounds like you've got a guy that is definitely vigorous in his domination of your other pup. So I think what you need to do is a couple of things. One is it bothering your other dog? And if so, maybe you can separate your pup. The other thing is he showing you any other symptoms of anxiety and overt aggression or dominance. And then that's where something like CBD may be helpful to calm things down. But this is an interaction between the two dogs, and this may be helpful for you to work with a trainer or a behaviorist to look for some other options here. But yeah, it's usually they're expressing dominance over the other dog. And right on, Ilsa. 225, perfect. Moist and flaky. And this is the thing, you don't want to overcook. And yeah, when he gets excited, exactly. So he's redirecting excitement and taking it out on the other dog. So you need to help him learn how to do something constructive with that excitement. Yep. So I think we have got one or two more questions. Let me pop back to our list here. And this is a really great one in terms of this kitty that's got urinary tract issues. Feline idiopathic cystitis. That's right, we did look at this one a while ago. Let's stop that one and come back over here. Yep, and I think that's got all of our questions answered. Y'all, thanks for sticking with me. Enjoyed the day today. Tell your friends. If you have not joined our circle community, go check it out because we'll be having a lot of content in there that's not available on our Facebook group. We are astonished how big this group has gotten and so fast. And actually, I'll answer this one because it is a great question. So if your golden doodle with the non-descended testicles is young, consider waiting a while because sometimes with time they will go ahead and descend, especially if the veterinarian can feel them on the outside of the body. They may just not have had enough time to do that. The difficulty with undescended testicles is that because if they stay in the abdomen, the chances of developing testicular cancer are much higher. And if he's 18 months old already, they may not descend. And that's where sadly surgery is recommended. If they are anywhere near the outside, you can feel them, then this is where I would continue to wait until 24 months of age, maybe even 36, and then go from there. And if they don't descend, what you've done is allow that dog to get enough testosterone and other sex hormones to fully develop. Golden doodles, sadly, are, if it's a toy, that's an interesting mix, but Goldens are one of the, oh, cool. So you can feel them in the inguinal area. Goldens are one of the breeds with the highest propensity towards cancer. And we know that if we spay and neuter, we're going to increase the incidence of cancer. So if you can feel them in the inguinal area, I would just wait a while, as uncomfortable as that may make your veterinarian. And then work with a trainer that knows how to help support dogs that are intact, because basically it's just teaching him a different set of manners. It's like I was talking with Evan Transud, Evan the health detective with the functional diagnostic nutrition program, and I was explaining it to him like this. If we think about young men as they become more sexually mature, they tend to make poor decisions, and so we have to help them learn to make good decisions. Same thing with our dogs and cats. We have to help them learn to make good decisions. And with intact pets, we have to help them learn what appropriate manners are. Hayo had to come up and say hey to everybody. Think about it that way. And it's a little bit different. There are many areas where dogs are not spayed and neutered. And because this is a normal way of life, the folks there know how to approach this. So that's cool. So, right, Lily? Testicles, I think, is what you mean. But yeah, this is a way to supply the raw materials for making hormones, especially to spay and neutered pets. Now, you do want to make sure that you are limiting the amount, because you can overfeed too much testosterone and create some issues in pets that are already not neutered. But it is a good idea in terms of supporting pets that are already spayed or neutered, so not just the boys. All right, y'all, that's what I've got for you today. Enjoyed it. Come back and see us next week, and we'll go from there. I'll have one of our coaches with us. We'll talk a little bit about what that person does in their coaching programs and go from there. Take good care. Cheers.